afternoon. Today we can go for a pharmacology of haemopoietic system. In pharmacology of haemopoietic system, first we can know about thrombosis. It is a major cause of death and disability. In thrombosis, there are three types of thrombosis will be there. One is venous thrombosis, next is arterial thrombosis, next is embolism. What is meant by venous thrombosis? It is a red thrombus associated with status blood, having a small component of platelets and a larger component of fibrin and blood cells. Arterial thrombosis associated with atherosclerosis, and thrombosis is white in color, having a large component of platelets. It is also leads to a infection, this myocardial infection. In embolism, it is a thrombus. It may break away, travel as an embolus. It leads to ischemia as well as infection. Before we can start this topic, that is anticoagulants, first we can know about this pharmacology of haemopoietic system. There are four categories very important. One is antiplatelet, next is anticoagulants, next is antifibrinolytic agents, and last one is fibrinolytic agents. How it is occurred? In this figure, we can know about how the platelet is responsible for the formation of clotting, and also how the coagulation may occur. Next, finally, how the fibrin must be destroyed. So this is a figure. Next is drugs acting on blood coagulation. That is drugs inhibiting coagulation and also drugs promoting coagulation. So drugs inhibiting coagulation to prevent thrombosis, that means antiplatelet agents, to prevent thrombosis as well as extension of thrombus, that is anticoagulants. Next, to lyse, break down a thrombus, that is fibrinolytic agents. What are the drugs promoting coagulation? In hemorrhage, due to overdosage of anticoagulants, in case warfarin overdosage, you can administer vitamin K as well as coagulation factors. In heparin overdosage, you want to administer protamine sulfate. In hemorrhage, due to overdosage of fibrinolytic, that is what is tranexamic acid, you want to administer to the particular patient. What are the major components of hemostasis? Here, first, initially, the injury may happen. Whenever there is an injury may happen, in endothelial tissue, it can go and call upon the platelets. Wherever the platelet will be there, it can immediately will come and activate the coagulation cascade, the clotting will be forming. So first vasoconstriction may happen, that's why the blood is coming out. After the blood is coming out, the platelet must be activated by endoplasmic the endothelium. The endothelium only the platelet is activated, the coagulation may happen, the clotting factor may occur. This is a major component of hemostasis. That's why we can give for antidotes. That is antidotes here. Why I want to tell means you want to give reversibly. You want to give, for example, vasoconstriction. Vasoconstriction means you want to administer what? Vasodilation or vasodilator. Platelet activation. So platelet activation means you want to administer antiplatelet. Here coagulation cascade. This clotting may occur here. So you want to administer what? Anticoagulants you want to administer. The final is fibrin is forming. That's why you want to administer fibrinolytic drugs. Okay. This is the major components of hemostasis. So this is the initial photograph I want to show for all. There is vasoconstriction, how it is occur, how the platelet plug formation is forming. Finally the fibrin mesh is how it is occur. Okay. These are the clotting factors. Total factor 13 factors will be there. So what are the various factors to occur for clotting of blood? First one is fibrinogen, prothrombin, there is thrombokinase, there is calcium, Labelle factor, Leiden thrombophilia, stable factor, anti-hemophilic factor A, Christmas factor, Stuart factor, plasma thromboplastin antecedent, this Hagman factor, and also fibrin stabilizing factor. These are the 13 factors responsible for the coagulation of blood. So this all guys will know about how the clotting will be occur related to there is all the factors may occur. There is a prothrombin to thrombin forming the other factor. There is calcium is responsible. The thrombin is responsible. Fibrination to fibrin. Okay. So the intrinsic system as well as extrinsic system. How the drugs must be given to inhibit this system to inhibit the clotting of blood. Okay. These anticoagulants. What are the drugs used to treat thromboembolic disorders? Three major classification of drugs will be there. One is anticoagulants, next is antiplatelets, next is thrombolytics. For anticoagulants, it is a suppress the coagulation cascade. Already I told. Example is heparin, next one is warfarin, next is antiplatelets. There is inhibit platelet aggregation. Example is aspirin and clopidogrel. Next is thrombolytic to promote lysis of fibrin strands causing dissolution of thrombi. This, there is a TPA, that is tissue plasminogen activator. Example was alteplase. First one, anticoagulants. These are the important questions they may ask in university. That is describe the classification of anticoagulants. It is in vitro as well as in vivo, and also discuss the mechanism function of clinical uses and adverse effect of heparin, and also what is discuss the mechanism function of uses, important drug interaction, toxicity of heparin, monitoring, therapy with anticoagulants. These are the questions again asked in university examination. What are the ways classification of anticoagulants? There are two types of anticoagulants. One is parenteral as well as oral. It is only in vivo only. In parenteral anticoagulant, there is indirect thrombin inhibitor. That is heparin, low molecular weight heparins. The second one is direct thrombin inhibitor. Example is lipirudin, bevalipudin. Oral anticoagulant example. First category is coumarin derivative. You want to tell heparin sodium is a very important one. Next is indane derivative. This phenadione. Direct factor saying that any inhibitor there is rivaroxaban oral direct thrombin inhibitor, that is dabigatran. So these are the agents it is used for the purpose of anticoagulants therapy. The first category is heparin. Heparin is an unfractionated heparin. That is molecular weight is 50,000 to 30,000 molecular weight. The low molecular weight heparin is the example is enoxaparin. The molecular weight is 5,000. What are the another one category is there is pentasaccharide derivative, that is fondaparin X, there is molecular weight is 1500. So these are the derivatives for heparin. Okay, what is meant by heparin? Heparin is a mucopolysaccharide and also it is the strongest acid in the body. It occurs in mast cells, endothelium, plasma, etc. Commercial source where it is derived is derived from pig intestinal mucosa and bovine lung. Activity is exposed in units. Always you want to exposed in for heparin in units only. This is the example category how the antithrombin as well as heparin may act. In antithrombin, for example, normally if your blood you want to clotting happen, after the clotting it may go for a antithrombin category, it leads to slow action only. But you want to administer heparin having 1,000 times fast when compared with the normal antithrombin. What is the mechanism of action of heparin? Heparin inhibits coagulation both in vivo as well as in vitro. That's why heparin is used in both in vitro as well as in vivo. Antithrombin 3 inhibits coagulation factor 10A and thrombin factor 2A. So next heparin combined with antithrombin 3, it increasing its activity by 1,000 times. That's why heparin regular dose was 30,000 units per day. It inhibits both factor 10A thrombin and prevents thrombus formation, and it's effective in thrombosis and also inhibit further expansion of thrombosis. So, sorry, thrombus. That is the reason you want to take heparin is superior when compared with the other anticoagulants. Okay. Low dose heparin. Heparin in a low dose, there is 10,000 units per day, it inhibits only factor 10A. But low molecular weight heparin, it inhibits mainly factor 10A, have less effect on formed thrombin. That is the reason LMWH as well as normal heparin. What is the difference? You can understand. Inhibition of factor 10A prevents activation of prothrombin, and it is fibrin formation and is effective only in prophylaxis of thrombosis. After the formation of thrombus, large dose of heparin is required to inhibit thrombin as well as clot elongation. That's why low molecular weight heparin is very essential for hemorrhage as well as thrombocytopenia. It is, and also you want to monitor not record for low dose of heparin. Heparin in case of 30 units per day, 30 units per day you want to administer. That is inhibit factor 10A as well as factor 2A. But LMWH only it can inhibit factor 10A. But in heparin you want to administer for 30 units per day. What will happen? It inhibits factor 10A as well as factor 2A. It prevents clot formation and inhibits expansion of and existing clot. Low dose heparin at 10,000 units per day inhibit only factor 10A. So LMWH can inhibit only factor 10A. That's why it is used in the treatment for thrombosis as well as prophylaxis of thrombosis. Okay. What is the drug characteristics? Heparin as well as LMWH. Why I want to again tell heparin as well as LMWH? The question may ask, what is the difference between heparin as well as LMWH? Or otherwise, sometimes they can ask in 5 marks also in university, what is mean by LMWH? Discuss in detail about LMWH. These are the questions again they can repeatedly they can ask. You, what is the use of heparin? This prophylaxis and treatment of thrombosis, but LMWH is only used for prophylaxis treatment. And also preference is for patients with renal failures, where LMWH is contraindicated. Preferred in all cases except in renal failure. Bioavailability for subcutaneous there is a 20%, the LMWH is 90%. Duration of action is an anticoagulant response variable. It is predictable, but it is having a longer acting. LMWH is longer acting, heparin have shorter acting only. So the background is what? Frequent bleeding. Here also bleeding will happen. Lab monitoring record, but LMWH not record. Used in hospital, but here is not a problem for in hospital also. Other actions of aspirin. Other actions of heparin. It inhibits platelet aggregation. It activates lipoprotein lipase and clears lipemic plasma. This is the reason you want to give for heparin having a not only having an anticoagulant action, it inhibits platelet aggregation as well as activates lipoprotein lipase and clears lipemic plasma. ADME. Root is heparin is given in IV as well as subcutaneous. Never intramuscular 200 administer. IV action is immediate. Subcutaneous answer is 1 to 2 hours. Half-life 40 to 90 minutes. The duration is a few hours. That is the reason you want to administer heparin within a few hours. You can get the action. You can release in your body. That is the reason you want to go for a LMWH. Okay. Heparin is used to initiate the treatment. After it attained the action, you can go for warfarin, go for started concurrently. It means it is for at least 4 to 6 hours. Heparin area. What is the adverse effect of heparin? Hemorrhage, alopecia, osteoporosis, spontaneous fracture, thrombocytopenia, hypersensitivity. What is the treatment in case you want to administer heparin? Suppose large dose they are taking, high dose they can take. What will happen? You want to administer protamine sulfate. It is the antidote for heparin overdose. Okay. Warfarin is the most important oral anticoagulant. It has a very low margin of safety. Hence, it requires dose monitoring by estimation of prothrombin time. It acts only in vivo, and also very important one, it acts indirectly as a vitamin K antagonist. Its onset of action is slow and duration of action is long. That is the reason you can prefer when compared with heparin. Warfarin is somewhat okay, but slight complicated will be there. I can discuss in a brief time. Warfarin. What is the mechanism action of warfarin? Always warfarin, already I told, is a vitamin K antagonist drug. Why means warfarin is a structural analog of vitamin K. It competitively inhibits epoxy reductase. This enzyme what? The name is shown as vitamin K epoxide. In vitamin K to vitamin K epoxide, vitamin K epoxide reductase is the enzyme. That vitamin K epoxide reductase must be blocked by warfarin that leads to inhibition of synthesis of coagulation factors like 2, 7, 9 and 10. These four factors must be inhibited. That's why the coagulation may arrest. Sorry, yes, coagulation may arise, clotting may not happen. That's why it is having a anticoagulant action. Oral anticoagulants, this warfarin, how it is forming vitamin K to vitamin K epoxide. The important is who? Vitamin K epoxide reductase that must be blocked by oral anticoagulant. Example is warfarin. What will happen? The factor 2, 7, 9, 10 was blocked. So the clotting is not formed. So anticoagulant action may happen. Mechanism action have warfarin. It acts only in vivo. Vitamin K catalysis are clotting for 2, 7, 9 and 10 and itself get oxidized into inactive epoxide form which is converted into the active form by the enzyme epoxide reductase. Warfarin is a structural analog of vitamin K and competitively inhibit the enzyme called epoxide reductase and it preventing vitamin K activation. What is the onset of action of warfarin? That's 24 to 72 hours is slow because the clotting factor present in plasma have to metabolize before warfarin action can be seen through all over the examination. Pharmacokinetics of warfarin. It absorbed always orally, highly protein in bound, is 98%, slowly metabolized in liver. Effects last for 4 to 5 days after the last dose. It crosses the placenta. Understand, very important point. It crosses the placenta. So, pharmacogenetic variation with warfarin. Some people may exhibit genetic resistance to warfarin action due to a mutational change in epoxy reductase enzyme, making it resistant to warfarin. Patients with resistance to warfarin do not respond to it. Warfarin, what is a warfarin ADR? Having a narrow therapeutic margin, bleeding is the commonest area, pruritus, chemoidosis, purpura. In women on oral anticoagulant should avoid during pregnancy. Why? It leads to a teratogenic drug. So leads to what? Abortion, teratogenicity, intracranial hemorrhage in the baby. That's why you cannot give it to pregnant woman. Uh, Warfarin dose needs to be adjusted by a regular laboratory monitoring by estimation of prothrombin time to main time, that is INR, that is international normalization result to minimize the risk of bleeding. That is very important one. Warfarin, you want to always, my estimation of prothrombin time must be monitored in the laboratory. What are the various drugs to decrease the action of warfarin? There is antiplatelet agents, this aspirin, clopidogrel, decreases metabolism, this chloramphenicol, metronidazole, fluconazole. Prothrombin time was the result. It means what happened? Hemorrhage may happen. What are the treatment of hemorrhage due to warfarin overdosage? Already discussed. It is a vitamin K type of drug. That's why you want to administer what? Administer vitamin K1, that is phytomeradionine, IV or transfused to plasma or prothrombin complex concentrate. You want to stop warfarin, you want to administer what? Vitamin K1. So there is the antidote for warfarin. What are the various drugs decreasing the action of warfarin? Its stimulation of metabolism, phenytoin, rifampicin, chronic alcoholism. Absorption must be decreased by cholestyramine. Vitamin K is also decreasing the action of warfarin. Next is hereditary resistance to warfarin due to mutational changes in epoxidase enzyme. You reduced in the prothrombin time, it results thrombosis. What are the various uses and indication for heparin as well as OAs, that is oral anticoagulants? Heparin and LM are used acutely. Warfarin is used for more prolonged therapy. Treatment for deep vein thrombosis, pulmonary embolism, menstrual angina, acute myocardial infarction to prevent extension of thrombus. Secondary prophylaxis of myocardial infarction, prophylaxis of deep vein thrombosis in patients on bed rest or perioperatively during and after coronary angioplasty. You want to administer what? This type of anticoagulants. And especially cannot administer through warfarin is not administered through pregnancy. Contraindication in anticoagulant therapy. This is what means allergy, neurological, and also recent stroke will happen. GIT, active peptic ulcer, active inflammatory bowel disease, cirrhosis of liver, you cannot administer. Cardiac severe uncontrolled hypertension, you cannot administer. Hematological pre-existing bleeding disorder is service, you don't administer anticoagulant therapy. In case of surgery on brain, spinal cord or eye, you don't administer anticoagulant. Additional contraindication, again I am telling, warfarin is not administered through pregnancy period. Warfarin merits and demerits over heparin. Warfarin is preferred for anticoagulation in outpatients. Dose is monitored by prothrombin time. Advantages over heparin can be given orally. Disadvantage compared to heparin is delayed onset of action, longer duration of action, 4 to 5 days after discontinuation, may make treatment of ADR is very difficult. What is the difference between oral as well as parenteral? Simply I want to discuss here. Oral anticoagulant example, warfarin and acetaminophen. Parenteral, heparin, LMWH is enoxaparin. It is indirect acting, slow onset of action, long duration of action, and it is vitamin K. It is act on both in vitro as well as in vivo, direct acting, fast onset of action, short duration of action, and antidote was protamine sulfate. Coagulants. What are the various coagulants used for the therapy? For replacement of coagulant factors, fresh whole blood or plasma, we want to give to the patient. In case of anticoagulant therapies, anticoagulant administer more or taken high dose, we want to immediately administer what? Coagulant. That's why you can go for fresh whole blood or plasma you want to administer to the patient. Prothrombin or concentrate complex, clotting factors, fibrinogen, fresh frozen plasma, and also treatment of vitamin K. Okay. Vitamin K is a fat. What is vitamin K? Vitamin K is a fat soluble vitamin present in plants. There is vitamin K1 or vitamin fast action IV synthesized by intestinal bacteria. Vitamin K2 or menopause administered by IV by slow IV infusion. What is the ADR of vitamin K? Rapid IV infusion may produce dyspnea, chest and back pain, and even death also will happen. Hemolysis will happen. Uses of vitamin K to treat hemorrhage due to warfarin overdosage. Babies to prevent hemorrhages for the newborn. Vitamin K deficiency, this malabsorption syndrome, you want to administer vitamin K. This is a simplified table column for heparin as well as warfarin advantages and disadvantages, and also chemistry, source, route of administration, onset of action, duration of action, activity, mechanism, antagonist, you want what type of drug you want to administer, variability in response, lab control, drug interactions, and uses. I can show in this table column. Okay, thank you for your patience.